Bone and cartilage tumors. First of the bone and cartilage tumors is the osteoma. Osteoma are most detected in adults, usually in the mandibular body, more common sa may lingual surface and sa condyle. Less common sites are the angle of the mandible, the coronoid process, and the ramus. If they occur, they are usually solitary and slow-growing. They can either be periosteal or endosteal. For if they are periosteal in nature, they can be polypoid, sessile on the surface. If it's endosteal, they are not that evident unless expansion occurs. Ngayon, kapag nakakita kayo ng multiple osteoma, ibig sabihin nun, possible na related to sa isang syndrome, which is the Gardner's syndrome. Kapag ganun, sabihan nyo na din si patient to check whether meron pa siyang ibang manifestations sa katawan, sa body, systemic manifestations. Isa sa mga kasama din sa Gardner's syndrome ay yung intestinal polyp. Okay, so better if ma-check din ni patient sa medical doctor niya if meron siyang intestinal polyps. Of course, kasama ng osteoma, merong pain. Limited din yung mouth opening niya, and kadalasan, bilang nagkaroon na ng expansion, magkakaroon din ng facial swelling or asymmetry din. So ito ang itsura ng isang osteoma. It can be evident sa labas, extraoral, like in the angle of the mandible. Ito naman, nangyari sa may palatal side ng alveolar process ng maxilla. Okay. Ito naman sa may mandibular area. Yan. So mukha siyang bukol. Radiographically, it will look like this one. Of course, osteoma siya, it will show a radiopacity sa radiograph. Depende kung gaano kalaki at kung gaano ka-compact yung bone doon. Katulad nito, masyado siyang compact. Ito, nangyari sa may condyle area. So this one, makikita natin, kaya siya ganito kasi ibig sabihin, mas madami yung cortical bone kumpara sa trabecular bone. Dito, possible na same amount lang din yung cortical bone formation sa trabecular bone formation. Okay. Histopathologically, osteoma will look like the normal dense bone with marrow. Okay, so makikita nyo pa din sa histopathologic features ng osteoma kung paano yung itsura din ng normal bone. So merong ayan, may mga deposition ng bone, woven siya. Yan, may lining, ayan. Organized yung pagkaka-lay down ng mga bone. Pero mapapansin nyo, meron mga trabecular area sa loob. Ayan. Pero nandun pa din yung mga osteocytes sa gitna. Those are the osteocytes. And makikita nyo, may laman yung osteocytes. Ibig sabihin, this is a live bone. So wala tayong nakikitang kakaiba. This is how a normal bone will also look like. The treatment for osteoma, if it's small, baka hindi na kailangan ng treatment. Kailangan lang i-observe periodically. If it's large, tapos symptomatic, kailangan siguro tanggalin by excision. Okay. Sometimes, if it occurs on the condyle process, kailangan ng local resection or worst case scenario, condylectomy. So if it's small, hindi na kailangan. Pag large, conservative excision. Or if it's on the condyle process, local resection. So that is osteoma. Normal lang yung sa pathologic features niya. Okay. So para siyang para siyang torus, pero sa ibang lugar siya nag-appear. Okay. And then we have osteoblastoma. Okay. Osteoblastoma also occurs in the vertebrae, long bones, pelvis, and of course, sa facial bones. Okay. Common area sa oral cavity is the mandible at the posterior of the mandible. Mas madalas ito sa mga babae. And sa sizes nito, it can range within 2 to 4 centimeters. It can present dull pain. Okay? Minsan, yung pain nito, hindi lang dull. It can also be tender and may cause swelling. Ngayon, syempre, pag may pain, iinuman ng gamot. However, in the case of osteoblastoma, kahit inuman, hindi sa kanya umi-effect yung NSAIDs. So, our mefenamic, ibuprofen, naproxen sodium, and other NSAIDs cannot relieve the pain caused by the osteoblastoma. Furthermore, osteoblastoma can cause tooth mobility, resorption, and displacement ng mga ngipin. Yun. Tatandaan nyo to ha. Sa osteoblastoma, pain cannot be relieved by NSAIDs. Okay. Ayan. So, this is a clinical feature of osteoblastoma. So, mukha lang din talaga siyang normal swelling, no? And mukha lang din talaga siyang parang yung ibang lesion, tumors na may swelling sa oral cavity. Yan. Pero of course, ang pinagkaiba nito sa soft tissue tumors, this one, hard siya kasi bone yung yung merong tayong problem. Sa soft tissue naman, may pagka-firm kasi soft tissue naman na yun. Okay. So it can cause asymmetry. Like this one, may asymmetry. So mukha siyang abscess. Mukha lang, pero hindi siya abscess talaga. So nakadepende yon kung paano inyo i-examine yung patient. Radiographically, osteoblastoma will present as a well to ill-defined round to oval radiolucency with patchy areas of mineralization. So here, the panoramic radiograph shows a somehow well-defined kasi medyo nakita natin pabilog, circular. You can also distinguish kung saan yung border niya. Okay? So it's round to oval radiolucency. Then makikita nyo sa gitna, mix. So may mga patchy-patchy. So may mga mineralization. Okay? So sa loob niya, may nagaganap na mineralization, may nagaganap na resorption, mineralization, may mga ganon. Okay? And here, this is an example of a CBCT scan of osteoblastoma. Okay, so makikita din natin dito na round to oval nga talaga yung shape niya. Tapos may mga patchy areas of mineralization sa gitna. Yan. Histopathologically, osteoblastoma shows irregular trabeculae of osteoid or woven bone. There are numerous osteoblasts. However, these osteoblasts have ample cytoplasm and hyperchromatic nuclei. Hyperchromatic, ibig sabihin, dark yung color niya. And aside from the presence of osteoblast, may scattered osteoclast din sa area. Tapos yung stroma naman ng osteoblastoma, kung ibig sabihin ng stroma is yung background, makikita natin yung dilated vessels, and somehow may mga hemorrhage din tayo. So ayan. So makikita natin, meron dito, ayan, mga woven bone. Ayan, mga mineralized component ng osteoblastoma. And then sa background, makikita ninyo, nandun yung mga hemorrhage. Yan. Yung mga reddish-purplish na yan, medyo reddish to pinkish na yan, yan yung mga RBC. Kaya masasabi natin na meron talagang occasional hemorrhage within the lesion. Okay? Dito naman sa kabila, makikita ninyo, yan, ito yung sinasabi ko sa inyong hyperchromatic. Sabihin, dark yung color ng mga nucleus nila. These are the osteoblast. Yan. Okay. So, dito sa baba, makikita natin somehow, I think this one is an example of osteoclast. This one is another osteoclast. Yan. Yan. Pero makikita nyo, osteoblast yan. Yung mga purplish, yung mga dark na, ano na yan, na purple. Mga lavender looking na yan. O yan, no? Mga osteoblast yan. And this one, these are the mineralized components. Okay. Makikita nyo pa din dito, may mga RBC, may mga red pa din, which are the RBCs, na sabi na talaga natin na meron hemorrhage within the lesion. So this is osteoblastoma. The treatment for osteoblastoma ay local excision or curettage. Okay? Meron nagkakaroon ng recurrence. The reason for recurrence is kapag incomplete yung excision niya. So as long as okay at complete yung pagkaka-excise, lesser yung chance or possibility of recurrence ng osteoblastoma. So again, osteoblastoma, the pain in osteoblastoma cannot be relieved ng mga NSAIDs. Okay. Next, the third lesion for bone and cartilage tumor is the osteoid osteoma. Okay. Nauna na kanina yung osteoma. Iba to hindi ito parehas ng osteoma. Osteoid osteoma ito. Okay. May konting lang tayo, trivia. Dati, ang osteoid osteoma ay under ng osteoblastoma. Pero nakita nila na merong kakaibang features itong osteoid osteoma. Kaya later on, hiniwalay na nila yung osteoid osteoma sa osteoblastoma. Okay? So, ganun din, ang osteoid osteoma, nakikita din sa mandible, usually sa second to third decade, yung age na to ay 25 years old ng patients. There is pain, severe at night. Sabihin, mas masakit sa gabi. Mas nararamdaman yung pain pag gabi na. However, yung pain naman ng osteoid osteoma can be relieved by NSAIDs, which is good news. Kasi even if severe at night, you can still take NSAIDs to relieve the pain. Unlike sa osteoblastoma na hindi talaga siya nare-relieve ng NSAIDs. So, that is how you differentiate clinical osteoid osteoma from osteoblastoma clinically. Okay, so if you give NSAIDs and then nawala yung pain, more or less, that is osteoid osteoma. If not, if hindi nawala yung pain, that is osteoblastoma. So, yun. So, halos parehas lang sila ng clinical features din ng osteoblastoma. Okay? So, madi-differentiate mo na lang talaga pagdating sa pain. Okay. Yun yung distinguishing differentiation. Yun ang key kung paano nyo madi-differentiate ang osteoblastoma sa osteoma. Kung paano nyo madi-differentiate ang osteoblastoma sa osteoid osteoma. Daming os. Radiographically, it is also well circumscribed, round to ovid radiolucency, but this one may contain small central radiopacity, unlike the osteoblastoma na patchy mineralization yung meron sa gitna. But for osteoid osteoma, it has a central radiopacity. So again, isa na naman to sa pwedeng differentiation ng osteoblastoma sa osteoid osteoma. Yan. Makikita nyo doon, mas uniform yung radiopacity na nasa gitna. Yan. Sabi ng mga pathologists, ang osteoid osteoma din, radiographically, can somehow parang representative of a target appearance. Okay? Kasi meron space sa paligid and then may radiopacity sa gitna. So parang may target nga naman, parang sa darts. Yan. Histopathologically, same lang din osteoblastoma. May makikita tayong hyperchromatic nuclei ng mga osteoblast. And then, nandun din yung mga mineralized components. May hemorrhage din. Sa treatment niya, same pa din sa osteoblastoma. Okay? So, importante lang din actually, important na malaman nyo kung ano yung difference nila para at least mabigyan nyo ng parang pain reliever yung patient if it's osteoid osteoma o palliative treatment, kumbaga. Okay? So, next ay Osteosarcoma. So from the name itself pa lang, no? Osteo means bone and then sarcoma. Sarcoma means malignancy. So may isip nyo na, this is a malignancy of the bone. Yan. So which is true enough. Well, osteosarcoma is the most common malignancy of bone. It occurs on the average age of 33 to 39 years old within the third to fifth decade. 6% of osteosarcoma occurs in the jaw bones. Okay. And osteosarcoma has a male predilection. However, there's an equal predilection for maxilla and mandible. Patient with osteosarcoma can present a swelling and of course can feel pain. If you would observe it, there would be tooth mobility, paresthesia, and nasal obstruction in patients with osteosarcoma. This is how osteosarcoma presents itself clinically. Yan, mukha lang din siyang may abscess, no? Okay, para siyang osteoblastoma din, no? Pero this one is osteosarcoma. Okay, rapid din yung pag-grow nito, eh. Rapid yung paglaki. That's why. Okay. Radiographically, it will show a radiopaque, mixed radiolucent radiopaque, or entirely radiolucent with ill-defined borders. Okay. There is a cortical destructions, wrong spelling, expansion, and periosteal reaction. Okay. With this expansion and periosteal reaction, makikita natin dito yung pinaka-pathognomonic radiographic feature niya, which is the sunburst appearance. Okay. Aside from sunburst appearance, makikita din natin yung Codman triangle and spiking ng affected ng ngipin because of root resorption. Okay. There is also widening of PDL in osteosarcoma. Okay, so yan. So this one is a panoramic radiograph and you will see a sunburst appearance. This is how a sunburst appearance will look like. It's like it's like the rays of the sun. Parang nandito yung sun and then may rays na palabas parallel to each other halos. Yan, no? Yung mga line-line na yan. Yan, line na yan. Yan, sunburst appearance. Yan, pa-line, outward, no? Yan. Kunyari, nandito yung ilaw, and then parang nag-radiate palabas. Pag ganyan. Yan o, line na yan. That is the sunburst appearance. So from that, ito naman yung tinatawag na Codman triangle. Kaya siya tinawag na triangle kasi shape siya ng triangle. Ayan o, triangle. Codman. This is a periosteal reaction. Okay? Codman triangle. Minsan, ganyan lang yan. Ganyan, mula dito, papunta dyan. Hanggang dyan lang yung makikita nyo minsan. Hindi nyo makikita yung full triangle na ganyan. Okay. Ito yung original na periosteum ng bone. Tapos umangat lang dito. Nagkaroon lang ng ganyan. Okay. Codman triangle. Okay. Di ko nasama dito yung spiking ng roots ng mga ngipin. Pero yung roots nila would look like parang yung sa heels sa mga sapatos kasi ninipis talaga siya, panipis. Kaya mukhang spike. Parang siyang sungay. Histopathologically, tumor cells are relatively uniform, round or spindle-shaped cells to highly pleomorphic cells with bizarre nuclear and cytoplasmic shapes. Matrix may vary considerably. So since malignancy siya, makikita natin dito yung mga malignant features like yung mitotic figures, increased nuclear cytoplasmic ratio, nuclear ng mga cells. Okay, yan. So mapapansin nyo, Yan. Okay, so ito yung normal bone. However, nangyari ng ganito. Yan, no? So, may mga mitotic activities. This one, mitotic activity. Ito din, mitotic activity yan. Mitotic figure, sorry. And then, from this picture, you can see hyperchromatism ng mga nucleus ng mga cells. Yan. And then, syempre, makikita ninyo yung increased nuclear cytoplasmic ratio bukod sa hyperchromatism. Okay. So, yun. This one, I think, is a mitotic figure. Okay, so makikita talaga, no, this is a malignant tumor, osteosarcoma. So, treatment for osteosarcoma is a wide surgical resection. And yes, there is a tendency for metastasis in osteosarcoma. Pwede itong maglakbay, yung mga cells nito pwedeng maglakbay within the body and affect different organs. Okay. And then, yun. So, I think osteosarcoma was the last lesion for the bone tumors. And we can move on to cartilage tumors. The first of which is chondroma. Okay, chondroma. Okay, chondroma is a tumor of mature hyaline cartilage. It is a benign tumor of the cartilage. It can occur on the second, third, fourth to decade. Okay, and it has a predilection to females. It can also occur. It commonly occurs in condyle or anterior maxilla. Bakit? Kasi nandito po yung mga karamihan na mga cartilage. Halos, no? It is painless and slow growing. Okay. If chondroma occurs on the condyle, it will present itself with pain and limit of mouth opening. Well, as usual, also some of the tumors, it may cause tooth mobility and resorption. So this is how a chondroma looks clinically. Hindi talaga natin ma-differentiate clinically. Hirap. Kaya importante na it's important that we do a biopsy so that we can further diagnose it definitively to know the proper treatment. Okay. So radiographically, it is a well-defined radiolucency with central opacification. Yan. Okay. Mahirap maghanap ng radiograph sa jaw, kaya this one is a radiograph from the long bones. But I think it will surely resemble like this one if it occurs on the craniofacial bones. Histopathologically, it's a well-circumscribed lobular mass of mature hyaline cartilage. Lacunae containing small chondrocytes. So the chondrocytes are with pale cytoplasms and small round nuclei. Okay? So yung mga lacunae contains small chondrocytes. So yan. Ito siya, macroscope. Medyo on a lower magnification. And this is somehow a higher magnification. So makikita ninyo, parang, ayan, may mga clear cytoplasms yung mga cells. Ayan. Ito yung mga chondrocytes. Looking on a higher magnification pa, makita nyo yung mga chondrocytes. Ayan. Round siya with clear cytoplasm with, ayan, sa gitna, yung mga nucleus ng mga cells. Those are chondrocytes. There. The treatment for this one is complete surgical removal. Okay, so that is chondroma, a benign tumor of the cartilage tissue. Next is the chondrosarcoma. Okay. Sabi natin kanina, osteosarcoma, bone sarcoma, malignancy. So this time, it's chondrosarcoma. From the word itself, chondro means cartilage in origin, sarcoma means malignancy. Okay, so this is a malignant tumor of the cartilage tissue. It's a malignant neoplasm. So the tumor cells form cartilage and they don't form bone. So most affected are elders. It occurs on the anterior maxilla. It's a painless swelling and may cause separation of or loosening of teeth. Sabi ko nga sa inyo, kaya sa tumor may cause mobility, separation, or loosening of teeth. This is how it looks like on a radiographic picture. So hindi natin madi-differentiate. Yeah. Okay. Some would interpret this one as a radiographic appearance for osteomyelitis or can be for oral squamous cell carcinoma. Okay, so ayan. So pag nakakita kayo ng ganitong radio, if you happen to see a radiographic feature like this one, you can include Chondrosarcoma to your differential diagnosis, osteomyelitis, and oral squamous cell carcinoma. Histopathologic features of Chondrosarcoma. It contains cartilage with varying degrees of maturation and cellularity. It may show lobular pattern with the center showing greatest degree of maturity and can also present with calcification or ossification. Yeah. So halos same lang sila ng chondroma, no? The difference with the histopathologic feature is the presence of malignant characteristics like yung increased nuclear cytoplasmic ratio, presence of mitotic figures, and hyperchromatism ng nucleus ng mga cells, pati ng nucleoli. Yeah. So yun. So yan. Medyo nakikita nyo naman yung difference, no? Kung bakit, kung paano. Okay. And the treatment for this one, just like Chondrosarcoma is treated with surgical resection then. Okay. So I guess this is the last slide for the bone and cartilage tumors. I hope you can now differentiate somehow the bone and cartilage tumors among each other and how to differentiate osteoblastoma with osteoid osteoma, chondroma from chondrosarcoma, and there. Okay, so please keep in mind those key points that I mentioned earlier. Okay, with that, thank you, and that's the end of a bone and cartilage tumor topic.